morning and welcome to the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
Good morning, everybody. I'm Rhonda Lohnert.
I'm Chuckalicious, Chuck Williams.
Millions of Americans who leave the hospital are readmitted within 30 days. That number kind of stunned me. That shocked me. But studies have shown that effective transitional care can help keep them home, which leads to better long-term health outcomes. Unfortunately, many patients do not receive the support they need. After being discharged from the hospital or urgent care facilities, patients are at a higher risk of complications, readmissions, and poor health outcomes. Transitional care, ideally managed by your family doctor, is a critical but overlooked component of the healthcare system. Joining us this morning to talk about us is Dr. Jason Nichols. Will be here to dig in on hospital readmissions. Doctor, welcome to the chat this morning.
Hey, good morning. Thank you for having me today.
Well, let's get right to this. The question is, why are readmission rates so high?
Well, as you guys mentioned, 1 in 6 Medicare patients are readmitted to the hospital within 30 days of discharge. So when we look across the system, that's millions of patients. It doesn't have to be this way, though. Part of the reason that it's so high is mentioned, there's lack of follow-up in regards to transitions process with the primary care physician overall. That, along with several factors around social determinants and medication errors, are some of the most common reasons for readmissions during that time.
It seems to me, it seems to me as though that readmission, hey, once you go into the hospital, you want to get out. So, you go home, go somewhere. Why should I revisit the program? Why should I revisit the problem again?
No, I couldn't have said it better. The goal, once you are discharged, is to stay at home. You want to be as healthy and possible as long as possible to keep you from the hospital. And one of those keys, obviously, as mentioned, was following up with the primary care physician to be the quarterback of your care overall. That first visit is very important post-discharge to actually set the game plan for what that means and what that's going to look like over that period of time.
Doctor, how do we reduce these hospital readmissions and help people stay healthier at home? What can we do for our loved ones and for ourselves at home?
So within the first 72 hours, the actually number one cause of readmission is around medication errors. And that's why it's so important to call and follow up with your primary care doctor during that period. That way they can reduce any medication errors that may occur if it's medication too high or too low. They also can help with transitioning the appointments to subspecialists, which is very critical. So if you need to see your cardiologist or your GI, gastroenterologist, all of those things, they help to try and coordinate and get you in a timely fashion. Another one that's often overlooked, but equally as important, is actually some of the social and economic factors. I mean, it's real easy to say we're going to keep you at home, but if I send you home on a medicine that's $400 or $500 that you can't afford, and you're not having that conversation with the doctor, they're unaware. And there are several things that they could do to try and help and alleviate some of that burden in order to keep you at home.
So we've got...
Go ahead, Rhonda.
We've got the medication and the transition and then maybe the economic impact. Are there any other things that we need to be communicating with our provider that maybe we might not think about?
That's a great question. Absolutely. I think the first thing is to be honest. Kind of with what you're saying. A lot of times people are scared when they come out of the hospital, especially if it's a chronic condition and they're seeing changes in their overall state and what that means. So that's one of the first things I'd say is always make sure to be honest with your provider. And if you have questions that you think about within the hospital and even when you're out, it's very important to write those questions down so you can ask your doctor, A lot of times you're in the hospital, you're seen by a multitude of providers, subspecialists, cardiologists, kidney doctors, stomach doctors. But being able to write all of those things down and take them back to your primary care doctor so you can have an honest conversation about what those things mean and to try and effectively transition you through the system.
It's amazing. And the one thing really shines through in this communication. You have to talk to your provider. You have to talk to the people in this industry, especially your own family medicine specialist. I think sometimes we look to the outside sources and we don't look to the person who gives us care each and every day, no matter what the issue is, and just ask some simple questions. Dr. Nichols, thank you so much for your time today. Really great information for us this morning.
Oh, thank you guys for having me.
Anytime. Dr. Jason Nichols is a family medicine specialist, and this was brought to you by WellMed. If you have any more information or you need more information, go to WellMed online and find out how to stay in your home and stay healthy after a lengthy hospital stay. We'll take a quick break. We'll be back with more chat on Newsday Amarillo and News Channel 10-2.